Dr. Henry Lim, it's a pleasure. Thank you so much for joining this Beating Melanoma project. Before we get going, I think I want to give you a brief introduction. I think we have a really, really great treat. So Dr. Lim is considered as one of the giant of dermatology, and you've been actually given the title of giant of dermatology. It's just well-deserved because you've been the chair of dermatology department at Henry Ford Hospital System for 20 years there. You were also served as the vice president of academic affairs. You were the president of the American Academy of Dermatology and the American Dermatological Association and American Board of Dermatology. You've written almost 500 scientific publications, edited 9 books. And I was lucky to sort of work with you on one of the book and a couple, like a dozen or so publications together. And you are perhaps one of the world authority when it comes down to phototherapy, photoprotection, and vitiligo. And you speak around the world, literally. So it is a great honor, Henry, for sort of agreeing to sit down with me and talk to us a little bit about photoprotection and skin cancer prevention. Welcome, Henry.
Thank you very much, Steve, for that very nice introduction, very kind introduction. My mother would have been very proud to hear that. But it is definitely a pleasure to be here. We have known and worked with each other for quite some time, so it's definitely a pleasure to be with you here.
Well, great. So, one of the questions, we always talked about is UV radiation causes skin cancer. That's a well-known fact, right? And we sort of share this idea, have a comprehensive strategy. What does that mean, Henry?
Well, I think comprehensive strategy for skin cancer prevention, specifically on photoprotection, is the total package of one, behavioral modification, specifically staying in the shade when outdoor. I want to emphasize there are a lot of benefits to outdoor activities. You live in California, people like to go outdoor, beautiful weather. We all enjoy that. So I think we should continue to encourage our patients who wants to do that to do so. However, we need to also emphasize to the patients, if they do go outdoor, do practice sensible photoprotection, which includes try to stay in the shady part of the street when you're outdoor, under the tree and so on. Number 2 is to wear photoprotective clothing. Nowadays, those clothing are very light, so it's not very stuffy, not very heavy, very easy to wear and comfortable to wear because it would help to protect the skin from the direct effect of sunlight. Wear white brim hats, wear sunglasses, and sunscreen obviously is an important, but not the only component, but it is an important component. So sunscreen should be applied on areas that otherwise would be exposed. So that is a total package of photoprotection that we need to continue to advise the public to do.
Well, why do you think it's so difficult? The American Academy of Dermatology did it. We'll talk about the risks of Skin Cancer Foundation. You and I always write about it. Why? I think the knowledge, everyone understood. Why is this so difficult? Why is it no one can do this?
I think it is getting better, but you're absolutely correct. There's still a significant gap between what we think the public should do, what we would like the public to do to protect the skin, and from what is actually done. I think there's several factors there. One, clearly, this is a significant activities that one has to do before going out to the sun. A lot of people they just want to go outside and just run outside and enjoy it, but without thinking about all these photoprotective measures. So there's an extra steps that one have to do. It's very similar to what buy an exercise bicycle, put it in a basement, right? Unless you are disciplined enough to be able to do that on the regular basis, you're not going to get the benefit from that. Okay, this is the same thing. Even if unless you put in the discipline to spend an extra few minutes before going out to the sunlight, before going outside to put on the appropriate clothing, sunscreen, and so on, a lot of time people forget. That is I think, one important aspect. The second important aspect is that especially for the younger people usually they feel, well, nothing is going to affect them, nothing is going to damage their skin and so on and so forth. So, for them, yes, skin cancer, wrinkling and all that, that is down the road, it's further down the road. They don't think much about it. Again, that is the part of education that we need to continue to do. In fact, for the younger generation, obviously, showing the photoaging changes, specifically the wrinkle formation, the blemishes that one can develop on the skin is much more impactful probably than just emphasizing to them about skin cancer, because a lot of time they think skin cancer occurs to someone else, but not to me.
Yep. Yep. You're right. And also there's this aesthetic element and the cultural bias, right? And I think that people want to have the tanned skin that conveys the luxury and the beauty, etc. So all those are the factors that it's hard to resolve.
Yeah.
I think the most people out here listening to this interview, they probably really want to know a lot about sunscreen, right? And this is always a controversial topic.
Right.
First of all, does sunscreen work in preventing skin cancer?
I think the data is quite strong that sunscreen does decrease the probability of developing skin cancer. The study from Australia that was done by Adele Green and her group is probably the best study right now, because it is a total of about 12-year study of a large number of individuals that showed that indeed the regular use of sunscreen did decrease the probability of developing skin cancer in those individuals who practice photoprotection. They have a control group compared to individuals who were not specifically instructed how to practice photoprotection. So there is an effect. Clearly, as any study, there are criticism on any of those studies, including this study. But overall, I think the data is very, very strong. I think you and I have been in practice for quite some time. We all can see that individuals who have had a lot of sun exposure, they tend to have more sun-damaged skin, including what we call actinic keratosis, which is the sunspot, rough spot on the skin, secondary to chronic long-term sun exposure, and to develop skin cancer. So we know that those are the group of individuals that are higher risk to develop skin cancer. Clearly, photoprotection, including the use of sunscreen, is very, very helpful. I think the science is quite strong on that.
Yeah, the science, obviously. It prevented the squamous cell cancer prevent melanoma by 40-50%, squamous cell likewise. And SPF sunscreen they were using was like low as 16 or something, right? So that being said, why do you think, sunscreen, at least in the US, is regulated by the FDA, right? And the product, the manufacturing, everything else is much more stringent than any other cosmetic product out there. Why do you think there's so much fear? People are worried. There's so many concern about use of sunscreen. And first of all, maybe we'll just step back. Maybe you can share with everyone, what are some of the concerns, right?
I think some of the concerns are the absorption of the active ingredients of sunscreen, which is what we call UV filters, ultraviolet filters. These are the active ingredients of sunscreen that get absorbed into the skin. And again, there are data now to show, indeed, if you apply sunscreen on the skin, all these UV filters would be able to be detected in the blood. Not surprising, because anything that you apply on the skin, it would get absorbed into it. So that had caused a lot of concern and a lot of quote-unquote fear about the sunscreen producing a negative side effect on human health. I should emphasize that sunscreen has been in use in the US since the early 70s. And at this moment, really, there is no signal, no reports of side effect from sunscreen, internal side effect of sunscreen that is caused by UV filters. We do know that sunscreen can cause allergic reaction on the skin, which is not surprising. Anything that you apply on the skin potentially can cause an allergic reaction. It is not common, but sunscreen can do that. But in terms of internal effect, the science is again quite strong to say that there is no known side effect. There are always, individual factors that shows that yes, something may increase, something may decrease. But if you want to look at it in totality, it is still very, very safe. In fact, the studies, as you well know, of showing that the UV filters can get absorbed into the skin is done by the FDA scientists. Very, very nice studies. But even in that article, they make it very, very clear in the conclusion section that the clinical significance of this absorption of UV filters remain to be seen. that one should not refrain from using sunscreen, and there is no indication that sunscreen is not safe. So I think even in that article, that make it very clear that if you judge the benefits and the risk of sunscreen usage, the benefit being photoprotection, decreasing the rate of skin cancer, and the risk, it's this unknown health effect of UV filters right now, the benefit far outweigh the risk.
Yeah, I'm going to just flesh it out a little bit more.
Sure.
And I think we should talk a little bit about the physical sunscreen, the inorganic filters, the titanium dioxide, zinc oxide. Everything you talked about is the organic filters, right? And I just don't like the name chemical filters because it seems like because everything is chemical. I think that the context that people are labeling physical versus chemical, automatically people just have this erroneous assumption thinking that chemical is bad and physical is safer, right? Everything, the filters you talked about are quote unquote organic, quote unquote chemical filters. What specifically are people concerned about when the filters absorbed into the UV? And what biological concern do they have?
I think some of the concerns has been the hormonal effect. There are some mostly in animal studies to show that the absorption of certain of these UV filters, of certain of this organic UV filters can cause, would have hormonal effect in terms of disruption of hormonal activities. Again, these are mostly in animal models. In human, the data is not strong at all. So I think that is the main concern about that. And again, nowadays the unknown that anything that gets absorbed, potentially could cause potential negative side effect. But I want to emphasize again that the data is not quite there.
Yeah, I mean, I think another thing we need to maybe mention is the usage level, right? The exposure level, and because I'll let you take over because what the FDA study did and how much sunscreen they put on versus the reality, how much people put on, and I think that is something need to be mentioned.
Yeah, the FDA study uses the so-called method of maximal utilization test method, which is essentially applying sunscreen to the maximum allowable or recommendable level, meaning applying sunscreen at 2 milligrams per centimeter square for their studies, which translate to about 1 ounce of sunscreen to cover the entire body surface. We know that in multiple studies, people have shown, we all have shown that in actual practice, individuals, including ourselves, we do not use sunscreen to that level. We use the average individual uses between 0.5 to 0.8 milligram per centimeter square, which is close to 1/2 to 1/3 of the level that the FDA use. Number two is that the FDA apply the sunscreen to individuals to the entire body surface. Again, for most of us, we do not apply sunscreen to the entire body surface because we have clothing on, we have swimsuit on, and so on and so forth. So, but their design was that to push the envelope essentially to see at the maximum level what type of absorption you would see.
Yeah, I just also like to add, I mean, not only they use the 2 milligram per centimeter square cover the body, everything else, but they repeated application every 2 hours, right? So I mean, I think that's about, I think it was 4 times or something to that effect.
Yeah, correct.
And so in general, most people just don't do this.
Yeah.
So that being said, right, we sort of set the framework, and here's a question. Do you use sunscreen, and what are you using? and what about your kids, and what about your grandkids? Like, what do you tell them, right?
I practice the total package, and as much as possible, I got my 6-year-old and 8-year-old grandkids to practice that package. Again, for those kids, not so easy, but they try. I try my best. They try their best. But essentially, I do wear hats when I go outside. I do wear photoprotective clothing when I'm outdoor. When I travel and so on and so forth, I do use that, and I put on sunscreen on the sun exposed area. And a lot of time nowadays, we all wear masks, and I would tend to wear masks not only to protect against viruses, but also as a photoprotective measure. That's one simple way to cover certain part of the face with that. In terms of, I prefer not to say brand, but then the sunscreen usually is the one that I'm comfortable with. I usually tend to use more of a cream or lotion type of sunscreen, and as long as it's elegant, my wife has her own our favorites, and I tend to use hers also, and what she likes to use. So that's what I use on the sunscreen.
Well, I can vouch that. I remember seeing you in Hawaii. We were hanging out together, and you were pretty covered. No, that's really good. I mean, I think here's something else. I think we should also just sidetrack a little bit, right? And so we know that we know this project is about beating melanoma. The highest incidence of melanoma skin cancer happens in people with Fitzpatrick type 1 to 3 Caucasian individuals. And one of the questions is perhaps we can delve into a little bit. The risk of skin cancer in Asian, Hispanic, and African Americans is much, much lower, right? In fact, you were a part of that working group in AAD that talked about, you don't really think that UV plays a major role for causing skin cancer in people of a skin of color, right? Why should people of a skin color use sunscreen, use photo protection?
Very, very good questions and very pertinent questions, because nowadays all of our practices we do see individuals of different skin types, light skin to very, very dark skin individual. I think the concept of what I call to be personalized photo protection is becoming an important and very relevant concept. This is very similar to personalized medicine, also known as precision medicine, right? Because they know for certain individual, because of the genetic mutations and all that, to treat their cancer, you go with this particular drug, while for the individual, you treat with other different type of medication. Very similar concept are for photo protection, specifically for sunscreen, depending on what we call skin phototype, meaning the skin color that you have, that you need to modify the type of sunscreen recommendation that you need to make. I want to emphasize that even for darker skin individual, yes, the risk, as you had mentioned, Steve, the risk of of skin cancer is significantly lower compared to fair skin individual, but it's not zero.
Agreed.
It is all, we all have seen individuals, and Asian, Latinos, as well as Black, who develop skin cancer. A lot of time they call pigmented basal cell, pigmented squamous cell, meaning their pigments in those cells. So the risk is not zero, lower, but not zero. So I think that is an important reason that they also, the darker skin individual should also be using sunscreen. Number two, the pigmentation, the blemishes that one developed. Again, the use of sunscreen, the use of photo protection would minimize the skin blemishes, the uneven skin tone that darker skin individual would develop. So I think there's another very good reason of practicing photo protection, of using sunscreen. Having said that, what do I mean by personalized photo protection? For lighter skin individual, we would recommend to use higher SPF, at least number 30 to number 50. Definitely outdoor, I would recommend usually 50. It has to be broad spectrum, because SPF, as we know, it protects, it measures the protections against UVB, which is the burning ray. But having broad spectrum sunscreen, which is important, is that it would mean that the sunscreen would protect against UVB, but also UVA, which is the aging ray, the ray that causes significantly wrinkling of the skin. So for the lighter skin individual, number 30 to number 50, broad spectrum. For darker skin individual, number 30 would be sufficient, because the risk of sunburn is not as high, definitely, for darker skin individual. So number 30, in my opinion, should be sufficient. But this group of individuals, because of the pigmentary changes that can occur with them, on them, because of UVA, because of visible light, they need to use a broad spectrum sunscreen. And ideally, they should use also tinted sunscreen, because currently tinted sunscreens are the only sunscreen that would protect against visible light, at least in the United States. There are new filters in Europe that, as you well know, Steve, that would protect against visible light. But in the US right now, there is none. So tinted sunscreen is the only sunscreen that would protect against the effect of visible light. So that's what I meant by this, by personalized photo protection from lighter to darker skin individuals.
No, I think we can probably spend another 2, 3 hours just talking about this. You know how much we always talk about this.
Yeah.
There's a lot in there, right? And you mentioned something about the damage the visible light can induce in pigmentation, especially in dark individual. And your group pioneered the research. Let's hold that thought for a second, and let's come back to another major topic. And I know you did a lot of work in that's polypodium leukotomas, right? And the brand name is HelioKit. It's an oral pill that you can take. And maybe you can set the stage and talk to
Sure.
folks about what it is, right? And then we can talk about how does it work, and maybe we can transition back into visible light protection.
Sure. Polypodium leukotomus is an interesting compound, actually. It's a mixture of compound. It is an extract of a fern plant that is grown in Central America. It is marketed here by multiple companies, but the one that has been best studied, and that's the one that I always recommend if I were to recommend Polypodium leukotomus, is the HelioCare brand that you have mentioned. Again, I don't prefer usually not to talk about the brand names, but for this particular one, because this is the only brand that has been the best studied one. So if you want to use that, that's the one that I would recommend. And it is manufactured by Ferndale Laboratories. So essentially, this is an oral supplement. Over the counter is considered to be oral supplement, so it doesn't require any prescription. It has an interesting property. It is a mixture of a number of compounds there, and it has an anti-inflammatory and antioxidative property, meaning it is a function as an antioxidant also. So what has been found, what has been shown in multiple peer-reviewed journals, studies published in peer-reviewed journals, is that one, the ingestion of Polypodium leukotomus could decrease the intensity of sunburn reaction when one go outside. And there are multiple examples of people taking Polypodium leukotomus. They go outside and they found that they get sunburn less severely, and they are less prone to develop sunburn as compared to be without Polypodium leukotomus. Our group have also shown that Polypodium leukotomus would downregulate, meaning would minimize, would decrease the visible light-induced changes of the pigment on the skin. Again, in that sense, it does help to protect. And there have been studies also to show that Polypodium leukotomus together with sunscreen would help to decrease the worsening of the melasma, which is the mass of pregnancy that occur usually in individuals who are pigmented, such as Latinos, Asians, especially on the cheeks, most commonly in women, but it can occur in men also. So, there are significant advantages of using that. It is a very benign medication, has been around, benign supplement, has been around for a long time.
I mean, listen, I can vouch for that because I used to live in New Jersey, New York when the sun is not that intense. But when I moved to California and walking on the beach, the sunscreen sometimes just not powerful enough to basically block out all the UV. And I start taking the pill, right? And the HelioCare pill. So I know it's like a personal antidote. It works.
Yeah.
And it's also interesting that talking about experiences, when I was at Sloan Kettering for like the last 16, 17 years, I did not see any patients with skin cancer, right? But in Asians, let's say in Asian particular, most of Irish descent. But coming into California in the last 3 months or something, I've seen like a countless number of Asians, Hispanics have skin cancers. So the risk is real, right? And I think your recommendation, personalized for the protection strategy, makes perfect sense. And I think maybe if we're gonna mention polypodium, and I think we should at least mention niacinamide, right? And why don't you take it away about what this oral supplement does?
Yeah. This is another oral supplement. The study was very, very well done a few years ago, published in New England Journal of Medicine, which is obviously a very, very prestigious peer-reviewed medical journal. The study was done from Australia. Essentially, what the investigators did is that they gave a group of individuals. These are all, they collected, first of all, a cohort of high-risk individuals. These are individuals who are known to have higher risk of developing skin cancer. Some of them had history of skin cancer. So they divided the group into half. One half would be given niacinamide. The other half would not be given niacinamide. And they measure the development of actinic keratosis, which is the sunspot precancerous skin condition, and they measure the development of skin cancers in these individuals. What they found is that after a year, there was probably 6 months. After 6 months, there was a decrease in the development of skin cancers, in the development of actinic keratosis in those individuals who were given nicotinamide compared to the control group. That's the strength of the study. One, they have large enough cohort of patients or subjects that they can compare the data from control group and for the group that had been receiving the nicotinamide. And what the other part that was very interesting is that after the completion of this studied phase, they stopped the study and they let the individuals who were taking nicotinamide not to take any nicotinamide anymore. So they go back to this, or like the rest of the control group. And what they found is that the rate of the precancerous skin condition, actinic keratosis, and the rate of skin cancer went back up to the original baseline state, indicating that for nicotinamide to work, one has to take that all the time. Which makes sense because nicotinamide is that the proposed mechanism is that it prevents what we call the energy crisis within the cell, because when cell is exposed to sunlight, they went into energy crisis because of that they cannot repair the damage of the DNA as well as otherwise, and then nicotinamide would prevent that, and so the cell continued to have the energy to repair those damage.
No, that's yeah. I mean, I think those are the two of my favorite oral supplement that I recommend to my patients, right? And I know there's a lot of stuff out there, like a lot of antioxidant, vitamin C, E, and other antioxidants, but those two are perhaps most well studied. And I mean, I think just in the context of beating melanoma, and the nicotinamide data is basically coming from preventing actinic keratosis and preventing squamous cell cancer, but not melanoma. But the idea, the extrapolation is both melanoma and squamous cell, basal cell, they are induced, caused by UV damage. So
correct.
Sometimes you just need a large, huge cohort, follow them over a long period of time, and just realistically speaking, those kind of studies just really difficult to conduct, basically.
Yeah. I think that is the reason that a Dale Green study, which is from Australia, also they were able to look at melanoma because they have large enough cohort, but also they have long enough follow-up. But even with that, the number of melanoma is very, very small. So in terms of statistical analysis, you cannot get the power to do that, but you can see the trend.
Yeah, you can see the trend. And I think for the sunscreen one, and they actually did show 50% reduction in melanoma, but but not the nicotinamide one. Well, Henry, I just want to say, thank you so much for taking your time and to join this project. And I know how busy you are. And I hope everyone out there learned quite a bit about photoprotection, both going from the comprehensive strategy as well as learning about some of the thought process behind sunscreen, the controversy behind it. And then we talked about some oral supplements. To me, I think the thing I learned most is I should have just asked your wife about what product we should use. I mean, that's the thing, right? We always just ask our spouses to use whatever they have, basically.
Right. Yeah, no, thank you very much, Steve, for having me. I think this is a great idea that you have of having these sets of interviews with various individuals and to try to bring the public an increased awareness about sun and the side effect of sunlight.
Yeah, and I hope to maybe get a chance to invite you back, and we can, for each one of the topics, we can spend almost another half an hour just on individual topics to flesh it out the difference. Well, Henry, thank you so much for taking the time, and all right, have a good day.
Thank you very much, Steve. Have a good evening. Bye-bye.
Bye-bye.